Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal Ministry of Health on an official visit in Delta State advocates continuous testing and sensitization to differentiate COVID-19 symptoms from malaria. Akwa Ibom government calls for caution among residents of the state in view of the recent spike in the number of COVID-19 infections. And South Africa's president promises vaccination access as he visits some vaccination centers around Johannesburg. And daily case numbers have continued to rise in recent days in Nigeria, even though the authorities are yet to officially state that the pandemic is now in its third wave. However, to prevent further spread, the federal government placed 6 states and the FCT on red alert, while asking subnationals to prepare and continue to enforce all protocols put in place, given the greater ease of spread due to the Delta variant. Last night, Nigeria recorded 535 COVID-19 new cases, the highest since March this year. The Nigeria Center for Disease Control also announced 5 deaths due to COVID-19 complications.
Given the rising number of daily COVID cases in Nigeria, the adherence to all non-pharmaceutical interventions is being emphasized through the NCDC's Take Responsibility campaign to curb the spread of the disease. After months of recording low figures of daily infections, the number of cases have been on the rise since last week, with the latest tally of 535 confirmed cases from 17 states and the FCT in the last 24 hours. Again, infection rates were largely concentrated in Lagos with 219 cases, followed by Akwa Ibom with 142, 47 cases from Oyo, 17 cases were recorded in Rivers. Jigawa and Edo registered 13 cases each, while 11 cases were reported from Ekiti and Bayelsa. 10 cases were reported from Ondo. Osun recorded 9, Plateau had 8, while Ogun and Kaduna registered 7 each. Other states include Kanu and the FCT with 5 cases each. Imo and Gombe had 4 cases, while 3 cases were registered in Nasarawa. According to the agency, there were 0 cases in Sokoto. The update also includes data from Oyo in the last 2 days and from Akwa Ibom for the 26th of July. The overall count of confirmed cases in Nigeria now stands at 172,263. 49 persons have been discharged in the last 24 hours, raising the total number of recoveries to 164,886. The agency reported 5 deaths from complications in the last 24 hours, increasing the fatality toll to 2,139. Presently, there are over 5,000 active cases in the country, while over 2.4 million samples have been tested so far. Over 6.5 million confirmed cases and more than 167,000 deaths have been recorded across countries in Africa. Globally, more than 195 million COVID-19 cases have been confirmed, while deaths have surpassed 4.1 million.
The need for continuous testing and sensitization has been identified as a way to identify COVID-19 from malaria, seeing as both diseases present almost the same kind of symptoms. This position was reiterated when Governor Koa received officials of the Federal Ministry of Health partners on the rollback malaria on advocacy visit at the Government House, Asaba. The team during their visits disclosed that malaria had remained a public health challenge in Nigeria, affecting young children and pregnant women.
The global COVID-19 pandemic appears to be testing the resilience of Nigeria's health system, and considering the heavy toll that malaria exerts on the vulnerable in the country, in addition to the fragile health infrastructure, authorities advocate the need to sustain efforts to prevent, detect, and treat the disease. It's the reason officials of the Federal Ministry of Health and partners on rollback malaria are visiting Governor Ifeanyi Okowa of Delta State with a view to improve sensitization on the prevalence of malaria in the state. The governor promises that his administration will continue to support the fight against every health risk.
We need to have a holistic look at the way we manage ourselves in this country. We will, as a state, by the grace of God, try to do what we ought to do and allow that the peers state primary care development agencies here, I need to immediately have the details of what ought to counterpart funding, so I will see what can be done on the part of the state.
Malaria and COVID-19 may have similar presentation with common symptoms including fever, breathing difficulties, tiredness among others, which may lead to misdiagnosis. The director of the Federal Ministry of Health emphasizes on constant testing to avoid such mistakes.
The essence of the advocacy is to bring to the notice of the state government the importance of testing when somebody falls sick, because the signs and symptoms of COVID equally mimic malaria. So there's need to test before treating, because it is only when you test before treating that you know when somebody presents with malaria.
While the country is working on flattening the COVID-19 curve, efforts should also be geared towards the advancement of the control of infectious diseases, including malaria.
The Akwa Ibom State Government has called for caution among residents of the state in view of the recent spike in the number of COVID-19 infections in the state. The government has appealed to members of the public to protect themselves by adhering to the World Health Organization approved COVID-19 protocol to curb further spread of the disease.
As the curve was flattening, and they were seeing results also, that 100 out of 100, 0 positive, out of 100, 0 positive from January to June. So people naturally relaxed that mankind, by the grace of God, had conquered COVID-19. But what we are observing recently is that it was not yet Uhuru with the Delta variant. So as I said, people relaxed. But you must have read our press briefing in this same conference room last week, which was a riot act. To reactivate all the enforcement mechanisms that we have put in place for citizens to comply with Akwa Ibom State Government and NCDC approved guidelines and protocols of COVID-19.
And to Yobe State, where the government has commended the World Health Organization for undertaking COVID-19 risk communication awareness across its local government councils, saying the efforts have yielded remarkable results. A public health officer in the state's Ministry of Health told Channels Television that Yobe is one of the states that have the least confirmed cases of the disease.
The city of Potiskum is the most densely populated local government council in Yobe State. During the peak of the pandemic, the city was placed on red alert due to possible community transmission as a result of its large population. The World Health Organization is providing support for the state government in its health system to mitigate challenges of COVID-19 pandemic as they embark on a sensitization campaign for residents in this community who may not have access to information.
The Yobe State Ministry of Health, in collaboration with partners, particularly WHO and Life Year Project and other developmental partners in the state, have contributed significantly to the reduced number of COVID-19 in the state. This is not unconnected with the responses in various localities, particularly areas of sensitization and awareness creation made by WHO and other partners in all the local government areas of this state. We are not also unaware of the support that we receive from the NCDC and other national bodies to the State Ministry of Health to respond appropriately to mitigate the impact of COVID-19 in Yobe State.
This campaign is timely for residents here who say they've had little or no information about the virus.
They've been sensitizing us on the COVID-19 disease. They taught us how to wash our hands and keep our environment clean. We were told to wash our hands regularly so that we'll not contract the disease.
Sensitization has helped a lot in our ward, as they've been going from house to house. It's a disease that most people have very little knowledge about, but now we have been told about its symptoms and how to stop its spread.
So far, Yobe State has had a record of 499 confirmed COVID-19 cases and 9 deaths across its 17 local government councils. The WHO says this collaboration will yield a positive response to health challenges in the state.
According to the NCDC, misinformation and conspiracy theories around COVID-19 are drivers of new infections in the country. Well, joining us to talk more about this is Dr. Abiodun Igwenu, epidemiologist and antimicrobial resistance program coordinator at the NCDC. She joins us via Zoom from Abuja. Thank you for joining us on the program.
Thank you for having me.
All right, first, let's talk about NICAFE, the Nigerian Conference of Applied and Field Epidemiology. What were the take-homes from such an extensive and intellectual gathering?
So the aim of the NICAFE conference is to talk about COVID-19 and other public health issues. We do know that COVID-19 has changed the way we do things, but it has also helped us to build back better in Nigeria. We do know that from the NICAFE conference, we have shown that we have now public health emergency operation centers in 31 states that can respond to various health challenges. We have digitalized our national surveillance architecture, and we also have over 120 labs that have been supported with infrastructure and also equipment to improve detection of COVID-19 and other public health challenges. So this virus has helped us to define or identify several gaps in our system, and we are already responding to fill those gaps that have been identified because of the COVID-19 pandemic.
Interesting. A lot of the speakers had many things to say, but one of them also was coming from the NCDC, and you also just mentioned it, and that is digitizing the sort of surveillance on the COVID-19 response. Can you expatiate more on that?
So when we talk about digitizing, it's to improve the way we access data. We do know that generally, when we started the surveillance in Nigeria, it's mainly paper-based, but it has its own challenges with issues relating to data errors and also transmission. What we've done now is we have a system called SOMAS, the Surveillance Outbreak Response Management System, that helps us to pick data in real time. And we can use it to pick even data that is from the community. So where the local government officials pick data on diseases or occurrences that are negative or can negatively impact health and transmit them in real time to both the state and national level to improve detection and also response to these public health challenges.
Let's talk about information on social media and COVID-19. How is that increasing infection spread across the country?
So because of the way COVID-19 came, a new disease, and as at that time there was no treatment and no vaccination, it left a gap in knowledge, not just of the general public, but even the scientific community had to quickly understand the virus. And this, once there's a vacuum, there's a chance for misinformation to actually multiply. And COVID-19, we now have a term called infodemics, where you have negative information filling the space of where we could have positive or correct information. So it has really affected the pandemic, and it's been challenging because aside from fighting the disease, we have to fight misinformation. And what NCDC has done is we have been collaborating with partners, with the community, to actually quickly check for information or misinformation that's circulating and look at this misinformation and respond with the correct information. It's been challenging, but we've been on top of this with the support of the community, with the support of other stakeholders that are also working with us to fight misinformation during this pandemic.
We'd like to thank you. We always appreciate your time on the program. Dr. Abiodun Igwenu is the epidemiologist, antimicrobial resistance program coordinator at the NCDC. Thank you for joining us this evening.
Thank you.
Well, still to come on the program, about 3 million people fully vaccinated in South Africa as the president moves to increase vaccine access. Please stay with us. South Africa's President Cyril Ramaphosa has visited some vaccination centres around Johannesburg today to assess the progress made so far in the country's vaccination rollout programme. It began at the Rabasutu Community Hall in Tembisa, a densely populated township, and moved on to a public-private sector vaccination centre in Midrand. Speaking to the media after the Tembisa inspection, President Ramaphosa said more and more ways are still being explored to improve vaccine access.
And one of the things I had come to check is whether they have any shortages of vaccines. They told me that they don't have shortages. They've never had shortages. But today is a bit of a slow day. And on a good day, they do manage to vaccinate quite a lot of people. We now have a much more confirmed good supply of vaccines. We're not going to run short of vaccines. We're bringing in quite a lot of innovation in the vaccination process. And the minister was telling me that one of the innovations is drive-through vaccinations, where people just come, stay in their cars, and they're vaccinated, the screening happens, and then they move on. And yesterday we saw the figures having gone up, and we will observe that today again. And if indeed we see that they are going up and up, then the National Coronavirus Command Council will evaluate the report, and the minister will also take the advice and advise the council, and then we take decisions.
And 2 people attending the Tokyo Olympics from overseas have been admitted to hospital with COVID-19 as daily cases in the host city and Japan as a whole hit new highs. Prime Minister Yoshihide Suga denied there was any link between the games and the simultaneous rise in cases in the country. Well, Dr. Jimmy Osinaike, primary care sport physician, PhD candidate in sports and physical activity at the Sports and Physical Activity Research Centre, Sheffield Hallam, the United Kingdom, joins us right now from Manchester. Thank you, Dr. Osinaike, for joining us on the programme.
Thank you so very much for having me on the show.
First, what's your take on how the sporting world has been affected by the coronavirus pandemic?
All right, thank you. The sporting world has been affected, quite negatively, and the implications of COVID-19 on sport depends on the perspective you're looking at it from. So from the perspective of fans, okay, so fans would oftentimes go to a football game for the camaraderie, for social engagement. So in regards to that, fans can no longer do that again. From the economic perspective, now we know that, quite a lot of, football clubs, sporting organizations, have actually lost quite a lot of money because, fans are no longer, in the stadiums and all of that. Now, from the perspective of health, now we also know that, sports physical activity generally, is good for our health. So because of the COVID pandemic, people can't go out, play sports anymore. They can't, do physical activity, which has, had negative effect both on their physical and also on their mental health.
Do you think that holding the Olympics under, a pandemic was the best decision?
Oh, well, I think there is really no right or wrong answer. It depends on the way we say it from. The World Health Organization director, said, something a couple of days ago before the Olympics. And it said that it was good the Olympics, started. It was good, we had it so that we would actually test run whether those safeguarding measures, would be translatable in other countries or in other sporting scenes. Now, some people are talking about the place of health. Are we not endangering the health of other people? But some other people have also argued that, we've got the vaccines now, COVID, the protocols on ground in Japan quite much. So there is probably, very, very limited risk of the COVID transmission. Now, there is the other aspect of, weighing the amount of money that have been spent in organizing this game and canceling the game outrightly. On record, it is, seen that these Olympics is most expensive in the history, and most people have the opinion. Why cancel it and lose that amount of money? So, basically, there's really no right or wrong answers. The Tokyo Organizing Committee and the IOC, have put in place strict measures, and hopefully we won't see any spread of the virus.
Now, finally, some of the sports are concluding, but we've also seen some notable performers drop out of the competition. Would you link the situation with the pandemic to their performance, especially in terms of their mental health?
Well, I don't think so. Now, after that, I've actually dropped that one, major highlights we've seen in recent time, that of Simone Biles, the American gymnast. And she said that, her mental health, was the reason why she pulled out of the Olympics. Now, the mental health issues she's having, is it because of the COVID pandemic? I don't know. I'm not too sure. It could just be because of the pressure, that these athletes would have to go through. Simone Biles is arguably the best gymnast in the world. She's been competing since when she's young. So it could probably be because, of the pressure, for her to perform, for her to actually maintain, that particular world record. Yes, there might also be, the place of COVID. It could be because of the pressure of the COVID. People have died in the course of COVID. The physical strain. That this pandemic has caused on people. That could also be a reason. But I don't think that the mental health issues, could directly be linked, to the pandemic.
All right, we'd like to thank you for joining us on the program. Dr. Jimmy Osunaike is a primary care sport physician. Thanks a lot for joining us on the program.
Thank you.
And Israel has announced that it will now offer the third shot of the Pfizer vaccine to people over 60. Let's take a look at the global update.
Israel's health ministry has announced plans to start a coronavirus booster campaign for adults who are over 60 years old and have received their second shot at least 5 months earlier, in the face of the potential risks posed by the vaccine's apparent waning efficacy and the current fourth wave of COVID-19. Dozens of protesters have staged a rally in front of the Japanese Prime Minister's office in Tokyo, calling for the country's leader to cancel the ongoing Olympics due to a recent spike of coronavirus cases. In Tokyo, where pandemic restrictions are mostly voluntary outside the Olympic bubble, daily infections hit a record 3,865. Daily cases nationwide also topped 10,000 for the first time. Over in Russia, the country reported 799 coronavirus-related deaths over the past 24 hours, an all-time high it has reached 3 times in the last month amidst a surge in cases blamed on the infectious Delta variant. The Coronavirus Task Force also confirmed 23,270 new COVID-19 cases in the last 24 hours, including 3,356 in Moscow. Pakistan will ban air travel for anyone without a COVID-19 vaccine certificate from August the 1st and will require all public sector workers to get vaccinated by August the 31st. The government says from August 1, unvaccinated people will no longer be allowed to enter government offices, schools, restaurants, and shopping malls.
Well, stay safe and continue to take responsibility. You can visit our website for more updates, breaking news, also a better understanding of the pandemic. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent. Stay safe.